Emotional video on Instagram revealing she has stiff person syndrome. It's a condition that attacks the nervous system. It is extremely rare. There is no cure, and Dion says it's impacting her ability to do what she loves the most, perform. Board-certified neurologist Dr. Tom Pitts joins us live. Dr. Pitts, thank you for being with us. You know, we heard her say this only impacts 1 in a million people. What does this mean for her going forward?
Thank you for having me, Nicole. Well, this is a rare neurologic disease, and it does affect about 1 in a million people. But that being said, there are many different subtypes, and we know that the progression or natural progression of these diseases somewhat depends on your response to therapy. And that therapy would be directly targeting the immune system. She has inappropriately formed an antibody or cookbook against the systems that naturally relax muscles. So you can imagine as a singer where you're doing complex diaphragmatic and laryngeal muscle work, the problem with stiff person syndrome is usually the antagonist and the agonist muscle contract and relax in concert. So if you flex your bicep, your tricep relaxes. In this process, both of them contract, and they can be stimulated by things like stimuli, loud noise, and there may be a profound anxiety of being in open spaces by yourself. So this could have a number of downstream effects, but I wouldn't count her out because there are some very aggressive autoimmune therapies that are available to her, and it also depends on the concomitant autoimmune disease. About 45% of these folks have diabetes, and a large group may also have a thyroid issue. So getting those diseases under control would also have an impact on that prognosis. So there's a lot of factors to consider.
So doctor, you talked about the muscles contracting, and she mentioned that spasms are really the main symptom here. You talked about some of the triggers for those muscle contractions, but are there other symptoms to this?
Well, the problem is there are downstream effects from that. So when we say a muscle spasm, it's not something like a cramp or something along the lines of that. This is a prolonged muscle contraction, and that can stop you from breathing. It can actually affect the truncal muscles, the voice muscles, the limb muscles. You can have falls that can lead to severe injury, which can cause downstream problems. And then I would also argue that there are symptoms associated with it indirectly, because again, these autoimmune antibodies can target the pancreatic beta islet cells, meaning diabetes, which can cause its own set of symptoms. And then furthermore, you can have thyroid problems, you can have anemia, which also preclude their own issues like fatigue, weight changes, hair loss. We notice a little bit of hair loss when she's in her video. She still looks beautiful. And that also could be from some of the medicine she's taking, prednisone or steroids, which can also have side effects. So there are many symptoms indirectly and directly associated with this, but make no mistake, the hallmark are these muscle spasms is kind of an understatement. These very intense and prolonged muscle contractures, which can involve part of the body and then eventually progress and actually cause whole body contractions, especially of the breathing muscles.
Oh.
And as you can imagine, that can be extremely anxiety provoking and certainly become a life-threatening issue.
Absolutely. The thought of that's terrifying. Doctor, really quickly, what about quality of life and life expectancy with this disease?
Well, you know, if you look online, I want to give Celine Dion some hope out here if she's watching. You know, you look online and it says 6 to 28 years, but that is all comers around the world, including countries and places where therapies are not available. I have seen people, as a neurologist, I'm also subspecialized in clinical neurophysiology with a specialty in rare autoimmune diseases and neuromuscular diseases. I've treated many people with stiff person syndrome. It actually used to be called stiff man syndrome, but we know that it's slightly more predominant in females. And I have seen people do very well with therapies, and not symptomatic therapies. They do give people muscle relaxants that can help their symptoms. We really have to target at the biochemical level her immune system. It has to be turned down with things like intravenous immunoglobulin, perhaps plasmapheresis, these strategies to displace her inappropriately functioning immune system and almost kind of replace it with a new immune system. And in a severe case, You could use even a stem cell transplant. If those are successful, you would be looking at a much better quality of life, and not necessarily that 6 to 28 year from diagnosis life expectancy that you see for all comers, including the untreated.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.